Good afternoon everyone, I am Samrida H. Pendatun. Today I will discuss the 5 stages of nursing expertise according to Patricia Berner's novice to expert theory. But before we get into these stages, let me briefly introduce Patricia Berner. Patricia Berner was born on August 31, 1942 in Hampton, Virginia. Patricia Berner is a nursing theorist known for her novice to expert model, which she was introduced in 1984. Her theory focuses on how nurses develop their skills and expertise through hands-on experience. Berner's model includes 5 stages: the novice, advanced beginner, competent, proficient, and expert. Each stage marks a different level of skill and experience in nursing. Now let's explore each of these 5 stages in more detail. The first stage is novice. This stage represents the absolute beginner, typically a nursing student in their first year of clinical education. They follow rules and guidelines strictly and also rely on instructors for guidance. So the nurses in this stage are absolute beginners. It means they are the individuals who don't have experience and prior knowledge about nursing field. On the other hand, at this stage, they are just starting to learn the basic knowledge and principles of being a nurse. Additionally, they rely heavily on procedures and to their instructors. Some of the reason for this is their lack of practical experience and confidence in handling situations. So basically, before they do tasks, they need to look at the procedures and ask their instructors help to make sure that they're doing things the right way to take care of their patients. The second stage is the advanced beginner. At this point, individuals have moved past the novice stage and have gained some level of experience and knowledge in their field. They have started to recognize patterns and develop some intuition in certain situations. However, they still rely heavily on rules and guidelines to make decisions. So, the nurses at this stage are starting to progress from being novices. Ibig sabihin, unti-unti na silang natututo at nakakakuha na ng kaalaman sa kanilang trabaho. And they begin to recognize common patient behaviors and know how to respond to that situation. They also experience both excitement and frustration because they can now perform some tasks independently but still struggle with more complex matters. Kaya kailangan pa rin nila ng guidance at rules para makagawa sila ng desisyon at maunawaan nila ng buo ang kanilang trabaho. The third stage is competent. The nurses in this stage are confident in their clinical skills and can perform most common nursing procedures with ease. Ibig sabihin, master na nila ang basic skills na kailangan para alagaan ang mga pasyente. Comfortable at sanay na rin silang gawin ang karaniwang ginagawa ng walang kahirap-hirap. For example, they can confidently take a patient's vital signs like their temperature, pulse, and blood pressure. They also have a good understanding of disease processes and common medications, and they are able to assess and monitor patients effectively. This means the nurses have a strong foundation of medical knowledge. Alam nila kung paano naaapektuhan ng sakit ang katawan and know how different medications work. Kaya rin nilang tukuyin ang mga posibleng problema ng pasyente sa kanilang sakit. For example, if a patient has diabetes, the nurse understands how the disease affects blood pressure or blood sugar levels and know how to monitor the patient's blood sugar reading. They are also comfortable communicating with patients and their families and can explain medical information clearly and concisely. This means the nurses have good interpersonal skills. They can communicate effectively with patients and their families, explaining medical information in a way that it is easy to understand. Halimbawa, kapag ang pasyente ay mag-undergo ng surgery, kaya na ng nurse ipaliwanag ang procedure sa simpleng salita, sagutin ang mga tanong at magbigay ng reassurance. Additionally, they are proficient in developing and implementing care plans and are able to manage multiple patients simultaneously. Ibig sabihin, organize sila at efficient. Kaya nilang gumawa ng detailed plan care para sa mga pasyente at mag-manage ng maraming pasyente. For example, the nurse might be responsible for 5 patients on a ward. They would create a care plan for each patient, prioritize their task, and ensure that all patients receive the necessary care. Furthermore, they are also good at prioritizing tasks and making quick decisions in stressful situations. This means the nurses are calm under pressure. They can quickly assess a situation, determine the most important task, and make decisions that will ensure the safety and well-being of their patients. For example, if a patient suddenly becomes short of breath, the nurse will quickly assess the situation, call for help if needed, and take steps to stabilize the patient's condition. The fourth stage is proficient. Proficient nurses have a more holistic understanding of patient care, perceiving situations as a whole rather than individual parts. Ibig sabihin, kaya ng mga nurse sa level na ito na makita ang buong sitwasyon ng pasyente. Hindi lang sa sakit nito, kundi pati na rin ang problema na nararamdaman nito internally. They also know what to expect in different situations from experience and can adjust their plans as things change. It means that based on their past experiences, these nurses can guess what might happen next and quickly change their approach if things don't go as planned. Additionally, they understand the patient as a person, not just a medical case. It means that proficient nurses see the patient as a person, not just someone with an illness. They think about the patient's feelings, how they live, and their personal situation. In this stage, they notice how patient feels, what's happening in their life, and what they believe about their health. Ibig sabihin, pinapansin ng mga proficient nurse kung ano ang nararamdaman ng pasyente emotionally, kung ano ang nangyayari sa kanilang buhay, at kung ano ang iniisip ng pasyente tungkol sa kanilang kalusugan or health. The last stage is expert. Expert nurses have a deep understanding of patient care, relying on their intuition and experience to guide their actions. It means malalim ang kaalaman nila sa pag-aalaga ng mga pasyente at umaasa sila sa kanilang instincts at experiences para matulungan ang kanilang sarili sa paggawa ng tamang desisyon. They can quickly assess situations, prioritize relevant problems, and make decisions based on their extensive knowledge. It means they are able to quickly understand what's happening, figure out problems, needed attention first, and make smart choices using everything they know. Expert nurses are highly skilled, flexible, and adaptable in their approach to patient care. It means these nurses are very skilled, can easily change their methods when needed, and adjust to different situations in patient care. That's all, and thank you for listening.